Good morning and welcome. Today is March 24th, Tuesday, year 2026. The Insurance Committee of the Tennessee House of Representatives of the 114th General Assembly is now in session. Members, please remember to register your presence. Mr. Clerk, please open the roll call. Mr. Clerk, please count the roll.
Mr. Chairman, you have 12 members present. You have a quorum.
Thank you. Members, do we have personal orders? It's my privilege to recognize the Doctor of the Day, Dr. James Haynes. Thank you for coming. And we also have members of the Tennessee Captive Insurance Association visiting us today. Okay. Representative Love, you're recognized.
Thank you, Mr. Chairman. The committee members, please make welcome. We have some folks from the Vanderbilt Divinity School here.
Well, thank you for coming. We will, without any further orders, we'll move on to our calendar for today. Without objection, we'll be taking item number 9, House Bill 2243, with the sponsor, Chairman Brock Martin, being out on a happy occasion. We have Chairman Timothy Hill presenting that bill. Members, do we have a motion? Chairman Hill, you're recognized on House Bill 2243.
Thank you, Mr. Chairman. And I've got an amendment 015367.
So we have a motion and second to attach amendment 01367 to House Bill 2243. All in favor, please say aye.
Aye.
Opposed? The amendment goes on the bill.
And thank you, Mr. Chairman. Do we need to add 14409 as well?
I think so.
And I need to add that one as well.
Let us get some input on it first. Do we?
Yeah. This.
We need to reconsider our actions on this one.
Okay. We have two directions on what we do, and we need to reconsider and redo our actions. The first amendment that we are going to adopt is 014409 to House Bill 2243. May I have a motion and a second? We have a motion and a second. All those in favor of attaching amendment 014409 to House Bill 2243, please say aye. Aye. Opposed? Amendment goes on the bill. Now we will add the second amendment, which we had previously added again, and that is amendment 015367. We have a motion and a second. All those in favor of attaching amendment 015367 to House Bill 2243, please say aye. Aye. Opposed? None. The amendment goes on the bill. Chairman Hill, everything is in great order right now.
Thank you, Chairman and Committee. House Bill 2243 seeks to prevent insurance companies from penalizing a doctor's year-end quality bonuses when an exempt patient opts out of a vaccine. And that's the quick summary. And Mr. Chairman, I believe we have someone here to testify if we could go out of session.
We stand out of session, and Mr. Andrew Schoenecker, kindly come up. Your mic should be on and pull it towards you. And for the record, please state your name and who you're with.
Andrew Schoenecker.
And you have 3 minutes.
Thank you, Mr. Chairman. And I'm just here representing myself. Mr. Chairman, members of the committee, thank you For the record, my name is Drew Schonecker. I'm here in strong support of the SHIELD Act and its amendment, having served as the bill's primary technical architect. The core intent of this legislation is straightforward. We must shield our pediatricians from being financially penalized by insurance companies for medical decisions they do not control. Right now, rigid MCO performance metrics are backing pediatricians into a no-win situation. Because the vast majority of insurance quality scores are tied to vaccine uptake, doctors are being forced into an impossible choice. Either take a devastating financial loss or dismiss children from their practices because a parent opts out of one or more vaccines. Before I go on, I want to be clear. The issue before you today is not a debate about vaccines. It is an issue of how a flawed insurance formula is destroying access to independent and rural pediatric care. To understand why, you must look at the bottom line. In the business of pediatric care, 10 to 12% of a practice gross revenue is tied to strict quality bonuses. Because the clinic's overhead is largely fixed, losing that 10 to 12% would erase their entire operating margin. Here's how that scenario forces their hand. When a parent opts out of even a single vaccine, the doctor's compliance score drops. To prevent that score from falling below rigid insurance thresholds and threatening their operating margin, a doctor's only financial recourse is to dismiss the families from the practice entirely. And though this may recover their score, it erodes the medical home and forfeits the chance to have conversations with their patients. Year after year, the financial pressure has compounded into a pediatric access crisis. Today, 4 East Tennessee counties have 0 certified pediatricians. 8 more counties in the state have fewer than 3. When doctors are forced to dismiss these families, patients go to urgent care or the emergency room, a more costly and inappropriate care setting. Recent changes in federal guidance stand to exacerbate this problem, as the CDC has recently reclassified 6 vaccines to the individualized choice, yet the rigid MCO algorithms will continue to penalize doctors despite this change. The SHIELD Act fixes this unfair system. It provides a surgical structural fix by removing patients whose parents opt out of a vaccine from the doctor's quality score. This is a structurally sound solution that is fully supported by the Tennessee Medical Association. We have also worked with TennCare to ensure that there will be no added administrative burden to the state, and we have secured a clean, not significant fiscal note. Together, the SHIELD Act with this amendment protect our pediatricians' financial health and ensure the doctor-patient relationship remains exactly where it belongs, between families and their pediatricians. So with that, I'm here to answer any questions you may have.
Thank you. You have described the situation accurately, clearly. Thank you. Members, do we have any questions for Mr. Schoenecker? Are you a pediatrician?
I am not. I am my company, we are a Medicaid provider in states that provide enhanced care management. So I come at this from the population health side of things.
All right. Seeing no questions, once again, we thank you for coming.
Thank you.
All right. And no other business outside the session. We'll go back into the session. Members, do we have any questions for the bill sponsor? Seeing none. Jermaine Hill, do you have a final word to say? Not hearing any. So without objection, we are voting on House Bill 2243. All those in favor? Well, Mr. Clerk, kindly open the vote. And all those in favor, please vote yes. Opposed, no. Mr. Clerk, please count the vote.
Mr. Chairman, you have 15 ayes, 1 nay.
House Bill 2243, having received the majority vote, moves on to calendar and rules. Thank you. Next item on our agenda is House Bill 1756 by Chair Lady Rudder. Welcome, Chair Lady. We have a motion and a second. And you have an amendment
Yes, sir.
013835.
That's correct.
Okay. We have a motion and a second on the amendment to attach 013835 to House Bill 1756. All those in favor, please say aye. Opposed? The amendment goes on the bill. Kindly explain your amended bill to us.
The amendment makes the bill So I will explain the bill. Treatment for individuals suffering from substance use. Treatment for individuals suffering from substance use disorder has been focused on medical and clinical side of recovery. While these components are necessary, they are only half of the equation. Recovery housing is the other half. Therefore, we would like to study our neighboring states to learn if any recent innovations that we can explore here in Tennessee. House Bill 1756, as amended, would direct the Department of Commerce and Insurance to perform this study and report their findings. We've spoken with the department, and they're good with creating this report. Furthermore, they are able to complete the study using existing resources, so there's no cost to the state. And so that is my piece of legislation, and I stand ready for any questions.
Members, do you have any questions? Representative Parkinson, you're recognized.
Thank you, Mr. Chair, and I just want to commend Chair Lady on the language that says the Commissioner of Commerce and Insurance shall use existing resources. I think I'm gonna start putting that in the front end of my bills too. Thank you for that. This is a good bill, though. Thank you.
Thank
Ms.
you.
Court.
Thank you.
Any other questions, members? I was just curious, are you aware of some neighboring states being better and we need to study them?
Well, no, sir, I am not aware, but I would assume that by that being in this piece of legislation, that they have already vetted this program and it was a good thing.
Well, thank you for your efforts, and that's something we need. Seeing no further questions, and without objection, we are voting on House Bill 1756. Mr. Clerk, please open the vote. Members, please register your vote. Clerk, please count the vote.
Mr. Chairman, you have 17 ayes, no nays.
Says every member voted, and okay, it's too late to change. House Bill 1756, having received a majority vote, moves on to calendar and rules. Thank you. Second, we have the next item, number 2, also by Chair Lady Rutter, House Bill 2162. We do have a motion and a second, and we do have an amendment, 014370.
That's correct.
We have a motion and second on the amendment. All those in favor of attaching amendment 014370 to House Bill 2162, please say aye. Opposed? The amendment goes on the bill. Kindly explain your amended bill to us.
Thank you, Mr. Chairman. This piece of legislation is known as the Patient's Right to Know. It's a transparency bill. This bill would require public reporting from insurers to the Department of Commerce and Insurance on the following: prior authorization, turnaround, and approval rates, denial and appeal metrics, payment timeliness, audit activity, recruitment of metrics, and customer service metrics. The goal of this piece of legislation is simple: to ensure that insurance providers are honoring their obligations. The goal is also to gather meaningful data that can be used to have a more meaningful policy conversation. It is well documented that increased transparency leads to improved performance. Tennesseans deserve to know more about the administrative processes in their health plans and reap the benefits from those improved plan performances. That is my piece of legislation, and I stand ready for
Thank
questions.
you. Members, you've heard the explanation. Do you have any questions? I think you have explained it well. Without objection, are we ready to vote? On House Bill 2162, Mr. Clerk, please open the vote. Members, please register your vote. Has every member voted? Does anybody wish to change their vote? Mr. Clerk, please count the vote.
Mr. Chairman, you have 17 ayes, no nays.
Thank you. The House Bill 2162, having received the majority vote, moves on to calendar and rules. Thank you.
Thank you, Mr. Chairman and committee.
Item 3 on our agenda is House Bill 1826 by Chairman Eldridge. Mr. Chairman, you're recognized.
Thank you, Chairman. Right now, county mutual insurance companies can only cover up to $100,000 worth of risk on a single policy without needing to go outside for backup insurance. And this bill just seeks to raise that cap from 100,000 up to 250,000 for the insurance.
Members, do we have any questions? Questions been called. Mr. Clerk, please open the vote. All those in favor of House Bill 1826, please vote yes, and those opposed vote no. Has every member voted? Does anybody wish to change their vote? Seeing none. Mr. Clerk, please count the vote.
Mr. Chairman, you have 17 ayes, no nays.
House Bill 1826, having received the majority vote, moves on to calendar and rules.
Thank you, Chairman and committee.
Thank you. Next item on our agenda is House Bill 1061 by Chairman Vital. Mr. Chairman, we have a motion and a second, and you have two amendments. Kindly tell us which one or which order you want to adopt them.
Thank you, Mr. Chairman. I believe it is 015044. Is that correct?
That is correct. So we have a motion and a second to attach amendment 015044 to House Bill 1061. All those in favor, please say aye. Opposed? The amendment goes on the bill. Kindly explain the amended bill to us.
Thank you, Mr. Chairman and members. This bill simply eliminates no surprise billing with ambulance services. Emergency ambulance services are frontline healthcare providers required by law to respond to 911 calls, regardless of a patient's insurance or ability to pay. Patients cannot choose their ambulance services. They're at the mercy of the 911 call and the response. Nearly 60% of ambulance transports are out of network. When insurers reimburse unreasonably low rates, providers are forced to balance billing plays into the scenario. It is estimated about half of our emergency ambulance rides result in surprise billing to the consumer. What is balance billing? Balance billing occurs when an emergency ambulance provider bills a patient for the difference between the provider's total charge and the amount covered by the patient's insurance coverage. This bill will provide comprehensive patient protections. It provides fair and prompt reimbursement, and it provides oversight and enforcement. And with that, we will try to address this issue and move forward with any questions you might have. Thank you.
You're recognized.
Thank you. Thank you, Mr. Chair. I want to say how good of a bill this is. This is really creating a sense of fairness for all the state of Tennessee. No matter what the insurance company, whatever, it's just a great bill. Thank you.
Thank you, Mr. Hafer. Mr. Parkinson, Representative Parkinson, you're recognized.
Mr. is fine, Mr. Chair. I call you Mr. Chair. Yeah, so thank you, sir. And thank you for bringing this bill. Where are you seeing this problem at? Is it in rural ambulance services, or what brought this about? And I appreciate it, but what brought it about?
Thank you, Mr. Chairman. For the question, mostly rural counties where there has been a delay in reimbursement and a question about the cost available for reimbursement.
And is it okay?
Representative Parkinson.
Okay. Yeah, and thank you for that. Most of you know that I served 25 years in fire services, so And, you know, and I know that this exists, right? And, you know, a lot of times people will forego using an ambulance or because of what the bill may look like if they have to be transported, you know, by an ambulance to a hospital or to somewhere else. So, man, I appreciate that. It's a good bill.
Well, thank you. Chairman Terry, you're recognized.
Thank you. And I guess a couple questions. What rate would these ambulance services be paid if they're out of network? Who's going to determine that rate? And then secondly, what is to prohibit in your bill a insurance carrier from just putting all these ambulance services out of network so they can pay them a lower rate?
Chairman Waddle.
Thank you, Mr. Chairman. Thank you for the question. It is proposed that if no local rate exists, payment defaults to the lesser of the billed charge of 425% of the Medicare rate. And second part of your question was?
If there was not a rate, what would prevent them from putting them out of network?
Well, regulatory authority would be provided to the Department of Commerce and Insurance to empower to take action against non-compliant insurers or agencies. And I think if there was a blatant exit of the ambulance industry, I'm sure the General Assembly would step up.
Yeah.
I don't know if is there a network adequacy that the insurers have to have? I mean, I don't know if that may be something you may need to get to me
We can
after.
look into it.
Okay.
Representative Hakeem, you're recognized.
Thank you, Mr. Chairman, and thank you, colleague, for bringing this forward. Just, I guess, some point of information or clarity for me. An uninsured person, would they be assisted by Medicare, Medicaid, something like that? Or what process would take place?
You're recognized.
I believe if they were uninsured and they were covered under Medicaid or Medicare, their rate would already be determined.
Thank you.
Chairman Lafferty, you're recognized.
Thank you, Mr. Chairman. This bill seems like it's going to be setting some rates to be paid for by the insurance providers. That money's going to have to be recouped somewhere. And I'm afraid that I feel like I do this every year. I'm afraid that the insurance providers are just going to slightly raise rates on everybody else that's not directly affected by this bill necessarily. And we're kind of putting a mandate on the companies to charge a little bit more for ambulance service. It's my concern, I've shared it with this committee numerous times, that as we continue doing this year over year, we keep on layering up the cost on the private insurers and us that pay those premiums. I just wanted to get that on the record. I appreciate the spirit of what we're trying to do here. I'm just not sure that I don't know what the answer is. I always have questions about bills like this, but thank you.
Chairman Watt.
I appreciate your sensitivity to the insurers. My sensitivity in this case is also to the providers. Many of them are public agencies that provide ambulance services that are uncompensated or wait indefinitely for reimbursement.
I was curious, how did we get to 425% of the Medicare allowable? That seems a lot. Kindly, as you looked at this bill, I'm sure you did some research and know about it.
In response to your question, this number was a combination of discussions with various organizations and with insurers.
Is this common interpretation would be that Medicare, if a person who's on Medicare uses the ambulance service, let's say that they were billed for $100, and if it is a non-Medicare patient, that they would be billed $425. Is that true, or am I not understanding it correctly?
If no local rate exists, payment defaults to the lesser of the billed amount or 425% of the Medicare rate. So.
Okay. So it is a generosity of the service provider who might charge less than 425. It seems tremendous. Chairman Speaker, you're recognized.
Thank you, Mr. Chairman. I'm going to vote for your legislation. It just seems like we could solve this whole problem if we just required the locals to have a rate. Across each individual county comes up with their own rate for ambulance service, and that's what the payment is. And therefore, we solve it statewide. I'm just kind of spitballing, but that's all. Thank you, Mr.
Well, it's a thought. Consider and see if you can construct an acceptable legislation. Chairman Terry, you're recognized.
Thank you again, and sorry, I keep having more questions pop up in my head. So this goes back to, again, what's the local rate? If there's two ambulance services competing in that same county, how would, and one's out of network and the other one's in network, how's the one that's out of network going to know what the rate is that their competition has in the county? Is that going to be published, or, I mean, how would we know that?
Chairman Waddle.
I would have to get you that answer. I'm not quite sure how that would be handled.
All right, thank you.
Was your question, Chairman Terry, was your question that if there are two ambulance services competing, how would we know what the other person is charging? Would that not be on Medicare records? Possibly.
It could be. It would be in their contract.
Chairman Hale, you're recognized.
Thank you, Chairman. When I look at this, Chairman Vital, I think that when we talk about ambulance services and when we look at our county governments, probably one of the biggest holes is emergency services being included is ambulance. So when we look at the money they're losing, these underfunded services, the taxpayers are already bearing that to shore up those services, correct?
You're recognized.
That is correct.
Okay, thank you.
Members, any other questions? Representative Parkinson, you're recognized.
Thank you, Mr. Chair. How does this affect the uninsured that are not on Medicaid or anything else, those that have to fall to the safety net?
Chairman Waddle.
Our ambulance services are going to continue to be picking them up and taking them to the hospital. This probably won't cover everybody, but it does provide an additional safety net for our ambulance services and our rural providers.
Okay, and thank you for that, Mr. Chair, if you're okay. But what will their rate be, and how, so how do we determine what they're being charged? Because there's still going to be a charge to them.
Well, I believe that rate would be set based on the universal rate that we would set based on the Medicare rate.
Okay, thank you, sir.
As everything else, indigent care would be provided out of the 425 they got on, other regular service. Partly, I would assume. Members, do we have any other questions? Seeing none, are we ready to vote on House Bill 1061? Mr. Clerk, please open the vote. All those in aye, please vote yes. Opposed, no. Has every member voted? Does anybody wish to change their vote? Mr. Clerk, please count the vote.
Mr. Chairman, you have 15 ayes, no nays, and 2 present not voting.
Thank you. House Bill 1061, having received the majority vote, moves on to calendar and rules. Thank you.
Committee.
Next item is House Bill 2097 by Chairman Reedy. Mr. Chairman Reedy, we have a motion and a second. You recognize on House Bill 2097. I don't see any amendments.
Thank you, Mr. Chairman and committee. And it's surprisingly that this is my annual pilgrimage to this committee since 2018 to extend the ground ambulance assessment extension. And yes, sir, that's the first time I have not had to amend this bill. So I stand ready for questions.
Can you, since we just talked about ambulance service, can you briefly explain what the assessment does?
Now, where we were talking about Medicare This is specific to Medicaid.
Okay.
Okay, so without using any state dollars, the ground ambulance services pay into a fund that draws down over 20 million in federal funds that is then paid back out to these services based on the Medicaid transports. And hopefully
Thank
that'll
you.
answer your question. And
Yes.
Mr. Chairman and committee members, if I could add to this conversation with ambulances, and of course, Houston County, when I was elected, the county owned the ambulance service. And it was interesting that I had the comptroller visit, and by the time we left the county mayor's office, he was bragging about not only owning the hospital, but also operating the ambulance service. And the comptroller at that time says, we had no business running that, and it was running us into the ground, not financially feasible for a county to operate it. And it was interesting, south of us was Humphreys County, and they bid their ambulance service out. In other words, they didn't own, the county didn't own the ambulances, they didn't run it, they didn't maintain the vehicles, and they were actually less burdened with the county government by not doing that. And then finally, Houston County finally wised up and said, okay, we need to bid this out and put the burden on somebody else. And that ambulance is actually running better than when it was county maintained. And I'll stand too with that, Mr. Chairman.
Thank you, members. Do we have any other questions? Chairman Lafferty, you're recognized.
Thank you, Chairman Kumar. Since we're having kind of sidebar conversations, I am missing my orange and white checkerboard tie.
It's up for bid.
At 425%.
Let's go Vols.
Members, thank you for indulging. It keeps things interesting. Are we ready to vote? Without objection, we are voting on House Bill 2097. Mr. Clerk, please open the vote. All those in favor, please vote aye. Opposed, no. Mr. Clerk, please count the vote.
Mr. Chairman, you have 17 ayes, no nays.
Has every member voted? Does anybody wish to change their vote? Seeing none, House Bill 2097, having received the majority, moves on to Finance, Ways and Means.
Thank you, Chairman.
Thank you for coming. Next item, number 6 on our agenda, is House Bill 1956 by Representative Alexander. You're recognized. We have a motion and a second.
Thank you, Chairman, and thank you, committee. This bill, HB 1956, expands protections for cancer patients in health insurance plans by removing step therapy requirements for all cancer diagnoses. If you remember last year, we passed a bill that did it for metastatic cancer, stage 4. This bill removes all step therapy requirements so that a physician can treat a patient with cancer with the drug they feel is the best without having the patient go through another drug for 3 months or whatever that might not get to the cancer. If we can do this, we can save lives in this state. And that's the whole purpose of this bill.
Thank you. Chairman Lafferty, you're recognized.
Thank you, Mr. Chairman. We've seen with the vaccinations and things that doctors' offices get incentivized to hand out, inject so many vaccinations. Are there any concerns with this bill that there will be incentives, inducements to the doctors to maybe jump from one therapy to the other?
Representative Alexander.
No, I have no concerns about that. The oncologists in the state of Tennessee are wanting great outcome for their patients. They're wanting them to live, to survive. They're not in it for the drugs or to get any kind of compensation like you had mentioned. They are there to take care of these patients. Our job as state legislators is to give them the tools that they need so that we can save lives.
Thank you.
I just want to clarify the implication that this bill does not say that step therapy is not allowed. It is the discretion of the physician, what will benefit the patient most. So if they think step therapy is okay, they can still use it, but they don't have to strictly follow that if they feel there is a drug that will serve the patient better. And is that correct?
That is correct.
Yeah. I think to Chairman Lafferty's point, yes, these are exceptionally dedicated people who are taking care of lives in danger. And I think money should not be a consideration, but I think it should not, human nature being what it is. Yeah. Chairman Terry, you're recognized.
Thank you. I just wanted to follow up on your comments and the comments that you had, being a physician myself, and if you've ever worked on or been on a cancer ward or taken care of patients that had cancer, having those conversations, these are tough conversations to have, and you are at your core rooting for these patients. And so I have no concerns about that being an issue. This is for the patients, and I commend you for bringing this bill.
Very well. Chairman Speaker.
Thank you, Mr. Chairman. So it's a great idea. I mean, it's a step in the right direction, but it doesn't include TennCare or our state plan. Is that to stay away from a fiscal note?
That is correct.
Okay, thank you.
That's an important point. I mean, lives are lives. Well, members, any other questions? Seeing none and without objection, we are voting on House Bill 1956. Mr. Clerk, please open the vote. All those in favor, please vote yes. Opposed, no. Mr. Clerk, please count the vote.
Mr. Chairman, you have 17 ayes, no nays.
Has every member voted? Does anybody wish to change their vote? Seeing none, House Bill 1956, having received the majority vote, moves on to Government Operations Committee. Thank you. Thank you. Item 7 on our agenda is House Bill 0705, sponsored by Speaker Marsh for Representative Gant. Thank you for coming. I see we have a motion and a second. You're recognized on this bill. I see two amendments.
Two amendments, correct, Mr. Chairman.
Both of them go on?
Yes, sir. Item 1 is 014074.
Members, do we have a motion and a second on Amendment 014074 attaching to House Bill 0705? We have motion and second. All those in favor, please say aye. Opposed? Amendment 014074 goes on the bill. Next, we have an amendment 015411.
Correct.
Okay. We have a motion and a second. All those in favor of attaching amendment 015411 to House Bill 0705, please say aye. The amendment goes on the bill. Mr. Speaker, explain the amended bill to us.
Thank you, Mr. Chairman and members. The first amendment deals with Mini Cobra, preserves what we took, the option that we inadvertently deleted last year in a bill. It restores Tennessee's limited continuation of coverage protections. It maintains options for Tennesseans who are transitioning from employer group health plans and short-term coverage stability. And that's what the first amendment does. It maintains the Mini Cobra. The second amendment, it expands offerings to customers so that they can protect high-value eyewear purchases such as designer sunglasses, prescription glasses, or electronic eyewear. It allows retailers at their discretion to offer eyewear insurance under an existing and well-regulated limited lines structure. It requires participating retailers to comply with the same licensing and consumer protection standards already in Tennessee law for portable electronic insurance like cell phones. modernizes the definition of portable electronics to reflect current technology and customer use patterns. With that, I'll answer any questions.
Thank you, members. So there were two parts that Mr. Speaker has explained. First one being Mini Cobra. Those plans are expensive but necessary when for short periods of time. And then the second about the technical coverage. Do we have any questions? Seeing none, we are voting on House Bill 0705. Mr. Clerk, please open the vote. Members, please register your vote. Has every member voted? Does anybody wish to change their vote? Seeing none, Mr. Clerk, please count the vote.
Mr. Chairman, you have 16 ayes, no nays.
Thank you. House Bill 0705, having received the majority vote, moves on to Finance, Ways and Means.
Thank you, Mr. Chairman, committee.
Chair Lady Moody, did you have a question?
If you'll pardon me, committee, I'm sorry I got so distracted. I wanted to remind you all that today is Ruben's birthday, and I missed that vote. But when you see him today, please wish him a happy birthday.
Thank you. Ruben is our Sergeant at Arms. We'll move on to our next item on the agenda. That is number 8, House Bill 1648, Chair Lady Halton Haynes. We have a motion and a second, and you're recognized on House Bill 1648.
Thank you, Mr. Chairman. I do have an amendment that makes the bill. Drafting number is 13652.
Yes, we have the same number. So we have a motion and a second on Amendment 013652 attaching to House Bill 1648. All those in favor, please say aye. Aye. Opposed? The amendment goes on the bill. Kindly explain your amended bill.
Thank you, Mr. Chairman. A 340B entity is an organization deemed eligible to participate in the 340B drug pricing program set up by the federal government. These organizations provide care and medications to some of our state's most vulnerable patients. This bill ensures that non-governmental 340B entities are subject to recognized fiscal and programmatic oversight by the state. The bill authorizes the state agency administering grants to these entities to verify and enforce compliance with all required 340B funding guidelines. It also codifies the comptroller's ability to audit such entities if warranted. And with that, I stand for questions, but I do have someone here to testify.
Okay.
If you desire.
Yes, if they have come to speak to the House, they're most welcome. Do we have it registered?
Yes, Dr. Shannon Berger.
Okay. With that in mind, we'll go out of session. Thank you. And Dr. Shannon Berger, kindly, your mic is on, state your name for the record, and you have 3 minutes.
Thank you, Chairman and committee members. My name is Dr. Shannon Berger. I am the CEO of SIMPA Community Care, and I appreciate the opportunity to speak. Chair Lady Halton Haynes did explain this pretty well, but just to add a little substance, the purpose of this bill is very, very simple. If a non-governmental organization is going to access this pricing as an in-kind designation of the state, there also must be clear oversight. Here's why that matters. The Tennessee Department of Health receives federal funding under sections 317 and 318 for STI prevention. They use those funds to purchase tests and then transfers a portion of those tests to entities that participate in the program. And that in-kind transfer is what establishes their ability to purchase drugs at the discounted pricing. When the state extends that federal authority, the state also must monitor the entity using it. And a pass-through entity who uses federal funds under this has to maintain compliance. So all this does is establish that structure within our state. It's a bill that fixes just the oversight gap, and it does not eliminate any STI programs. It does not restrict any testing or treatment, and it does not apply to government entities such as county health departments. All it does is establish a basic accountability standard. It gives the comptroller administering and the administrating agency authority to verify compliance within the program. And if an entity does not receive another grant, the Department of Health could easily issue a structured grant agreement, even at a nominal amount, to establish the oversight framework in this legislation. Thank you.
Well, thank you. Members, do we have any questions? Seeing none, thank you for explaining Representative Parkinson. How could I forget you?
I don't know, Mr. Chair. Trying to figure that out myself. And thank you, Mr. Chair, and thank you for your testimony. Two questions. One request and the question. Can you explain to everyone and the two people watching online what the 340B program is, and explain what STI is also?
Sure. So first answer is the 340B drug pricing program was established by the federal government over 30 years ago. It is a condition of manufacturers to participate in Medicare and Medicaid. They have to offer a discount to entities who serve the state's safety net. So in essence, we get to purchase the drugs at a little bit of a discount. We use that savings to then help cover the uninsured patients who have no ability to pay. So if you think about it, if there is a drug that costs $100, the normal reimbursement is $90. We may purchase it for $70, and we keep that $20 savings to then use for the uninsured patients. Does that explain in the shortest way I could?
That's actually the best explanation of 340B that I've heard to date.
Thank you.
And but I think it's important for the layperson to understand, because of course this 340B deal has been, it's been a fight about that nationally, right? And so I think that's important for people to understand.
And then can I explain the STI? So most of the time you hear STD, that stands for sexually transmitted diseases, but most are only infections because they're treatable. And so that's where you get the terminology STI.
Right. And thank you. And I just wanted to make sure that everyone understood that this was not a military, well, it probably is a military acronym, but that we were talking about that specifically. Right. And so thank you for that. Thank you for your testimony. And who do you represent also?
I'm with SIMPA Community Care. We're a federally qualified health center and Ryan White HIV clinic in Chattanooga, Tennessee.
Thank you for that. Thank you so much.
Members, any other questions? Seeing none, thank you for coming. We appreciate you. We'll go back into session. So, Chair Lady Hilton Hales, do you have any final words on it?
I think she covered it very well. I would appreciate everyone's vote. Thank you.
Members, do we have any questions for the sponsor? Seeing none, and without objection, we are voting on House Bill 1648. Mr. Clerk, please open the vote. Members, please register your vote. Has every member voted? Does anybody wish to change their vote? Mr. Clerk, please count the vote.
Mr. Chairman, you have 17 ayes, no nays.
House Bill 1648, having received the majority vote, moves on to calendar and rules. Thank you. Next item on our agenda is House Bill 1477 by Representative Hakeem. We have a motion and a second. You're recognized on House Bill 1477.
Thank you, Mr. Chairman. We do have an amendment.
Second.
Yes, I have 010995.
Yes, sir.
We have a motion and second to attach amendment 010995 to House Bill 1477. All those in favor, please say aye. Opposed? The amendment goes on the bill. Representative Hakeem explained the amended bill to us.
Thank you very much, Mr. Chairman. This legislation is about one simple principle: transparency where the public is harmed. Insurance claims handling directly affects the health, safety, and financial security of Tennesseans, particularly our seniors and vulnerable adults. Claims are delayed, misrepresented, or improperly denied. Families can suffer serious financial consequences. Under current law, certain confidentiality provisions make it difficult for the public and even lawmakers to see patterns of substantiated misconduct. This bill changes that. It requires the department to publicly disclose substantiated violations involving failure to timely investigate or pay claims, misrepresentation of coverage, patterns of unfair settlement practices, and violations affecting Tennesseans over 65 years of age or otherwise vulnerable persons. Importantly, this legislation does not, I repeat, does not disclose personal information. It does not release medical records. It does not expose trade secrets, and it does not interfere with ongoing investigations. Only final substantiated findings would be published. And I would also find in my closing add, Mr. Chairman, again, this is simply about transparency. It does not create new mandates on how insurers operate or if insurers that what is already happening is visible, measurable, and accountable. We have worked with the Department of Insurance, Commerce and Insurance, and a number of industry stakeholders to shape this legislation. And that collaboration is reflected in the support we've received. Thank you, Mr. Chairman. We stand for questions.
Thank you, Mr. Representative. We have questions. Representative Love, you're recognized.
I would just like to add an amen to Hakeem's presentation. Thank you for looking out for our seniors.
Thank you. Chairman Lafferty, you're recognized.
Thank you, Mr. Chairman. Representative, I heard you mention misrepresentations of coverage. I knew a fellow one time that got into the insurance sales business, and I also knew the fella to not be very truthful. And it was very concerning when I heard what he was doing because I thought, geez, oh, Pete, this guy will say anything to make a nickel. How do we delineate the salesman as a bad actor versus the company as a bad actor?
Representative Hakeem.
All right. I think what we have to take under consideration is that what we're proposing put forth substantiated claims and not, I don't know if I use the term hearsay. Right. And we're trying to use factual data that will bring about a better environment for seniors and those that may be considered vulnerable. I hope that answers.
Thank you. Thank you,
Yes.
Representative.
I think to translate it, would that mean that there is a complaint about the company, it is reported to the department, it is investigated, it's substantiated that it is true, that such problems would be listed for public view? Is that a fair statement?
Yes, sir, it is. And we have along the way worked with the department. And so we feel that this is something that hopefully will go forward. And I would also add that there's no significant fiscal note.
Well, thank you, Chairman. Speaker, you're recognized.
Thank you, Mr. Chairman. I like the bill. The only thing I wish we would have done was break it into maybe large, medium, and small insurance companies. Because if, for instance, if one of our large carriers had 40 issues, but they service millions and millions of claims versus somebody that may only service 1,000 claims and they have 20, that aggregate is worse on the small, it's worse on the small one, but in reality on the report, it would look like this major one had 40 claims. So maybe in the future, we look at breaking that out in the aggregate a little bit so people have a better understanding of large, medium, and small.
Representative Hakeem.
Thank you, Mr. Chairman. I concur with your concern, and I think working with the department, we can come to a point where I think we're all on the same page.
I think that's a very good idea. I had looked at that too, and thinking was that maybe violations per so many claims should be listed to give it perspective. Yeah, thank you. Representative Parkinson?
Thank you, Mr. Chair. Move previous question.
All right. No objections? We have, you withdraw it. Okay, we do. Thank you for withdrawing that motion. Chairman Sparks, you're
I
recognized.
just want to say thank you, Hakeem, for working this. I just wanted to give a shout out to Allstate. My parents were with them for 56 years. And after my mom died, I was having trouble and couldn't hardly get a call back from. Terrible service. And that's my little shout out to Allstate. So thank you for the bill, sir.
Thank you, Mr. Chairman, and thank you, sir.
All right. Well, thank you, gentlemen. Without objection, then we are voting on House Bill 1477. Mr. Clerk, please open the vote. Members, please register your vote. Has every member voted? Does anybody wish to change their vote? Mr. Clerk, please count the vote.
Mr. Chairman, you have 17 ayes, no nays.
House Bill 1477, having received the majority, moves on to calendar and rules. Thank you. Last item on our agenda, House Bill 2411. Representative Jones, you're recognized. We have a motion and second.
Thank you, Mr. Chairman. This bill seeks to add to change the committee of the Statewide Planning and Policy Council. This was created years ago for the Department of Disability and mainly focused on the Department of Disability and Aging. So this legislation would add 4 seats to that council. One TennCare would be a TennCare employee, and then the other 3 would be one from each of the MCOs. The hope is that it is important that the TennCare Bureau receive and consider the recommendations of council as it relates to services and supports for those with disabilities.
Thank you. I was busy coughing and I forgot to attach the amendment.
Oh, I'm
So
so
let
sorry.
us do that.
Motion?
It's amendment number 013459.
Yes, sir. That's correct.
We have a motion and a second. All those in favor of attaching amendment 013459 to House Bill 2411, please say aye.
Aye.
Opposed? The amendment goes on the bill. You have already explained your amended bill to us. Members, do we have questions? Seeing none, and without objection, we will vote on House Bill 2411. Mr. Clerk, please open the vote. Members, please register your vote. Has every member voted? Does anybody wish to change their vote? Seeing none, Mr. Clerk, please count the vote.
Mr. Chairman, you have 17 ayes, no nays.
House Bill 2411, having received the majority vote, moves on to calendar and rules. Thank you. That completes our calendar. Members, do you have any parting thoughts? Seeing none and without objection, we stand adjourned.